Good evening, everybody. It is once again Ted the Speed Learner, and I'm sure by now you remember a long time ago I was trying to cover the healthcare bill, and I just got tired and I had to do all this other stuff, and I never really got around to continuing the coverage of it. Now the election is here, I probably should continue on. In the last section we were talking about state exchanges. I hope somebody watches that particular video and comments on that. I would like to have more details on the state exchanges. However, we are going to move on here. We're going to talk about the next section of the bill, which is section 1101, which states immediate access to insurance for uninsured individuals with a pre-existing condition. There's a mouthful. This is the one that people argue, oh, we got to talk about this. Okay, so let's just go ahead and talk about this. The Secretary of Health and Human Services has now established a temporary high-risk health insurance pool. Okay, remember, these people that are going to be a part of the insurance that's going to be a part of their pre-existing conditions, the reason he's setting up this high-risk pool is because we know that they have a condition already and they're going to need medical assistance. Okay, when they set up medical pools, it's for people normally that don't have any conditions, and eventually if something does turn up, then they can actually tap out of that pool. Well, now these people actually do have a medical condition, so they know that the very second they're loaded onto this thing, they're going to have to start paying out. Okay, let's take, for instance, let's say you have a person, he's in perfect health, he gets into a pool, and eventually he ends up with a heart condition and he starts taking out of the pool. Now he loses his job. Okay, now his heart condition doesn't go away just because he loses his job. So he gets onto another insurance. Well, that other insurance is going to have to start paying on this heart condition because, after all, he now has it. Okay, so they wouldn't put him with the pool of all the healthy individuals. Now they put him with the high-risk pool. Okay. Now, this high-risk pool has already been established. Okay, the very second this bill became a law, they established it. It was supposed to be established within 90 days of the passing of this bill, and that, of course, happened 2 years ago. So the pool has been established, and it will remain in place until the 1st of January 2014. Okay, so the Secretary of Health and Human Services established a special pool for all these people that already have these high risk, and there you go. Alright, now the Secretary can carry on this program directly, or he can make contracts with eligible entities. Now, what is an eligible entity? Well, they define this in the healthcare bill. Eligible entities are as follows. They can be a state or a non-profit entity. Okay, so if the Secretary of Health and Human Services enters into a contract, he either enters into a contract with an individual state, or he enters into a non-for-profit healthcare insurance. Okay, and now these people, whether they be the state or some private not-for-profit healthcare industry, they have to submit to the Secretary an application at the time they want to establish this contract, and in such a manner and containing such information as the Secretary may require. So if the Secretary says, I got to have X and Y information about your not-for-profit healthcare insurance, and so they have to provide that. Alright? Whoever gets into a contract with the Secretary of Health and Human Services, they have to agree to utilize the contract funding to establish and administer a qualified high-risk pool for eligible individuals. Okay, so they have to establish this high-risk pool. They're getting money from the Secretary of Health and Human Services to establish this high-risk pool. They have to then administer it to the people who are in need, so on and so forth. To be eligible to enter a contract with the Secretary, the state shall agree not to reduce, okay, the annual amount the state expended for the operation of one or more state high-risk pools. Now, the individual states have already got these high-risk pools, as like the Secretary of Health and Human Services is trying to establish. So they are funding these high-risk pools, and they cannot shut off that funding because if they do, they'll no longer be eligible to be in a contract with the Secretary of Health and Human Services. So let me say that again to get it quite clear to you people. At least some, if not all, of the 50 states have a high-risk pool for those people with pre-existing conditions. Now, I don't know how many of them already do, but some of them do. And they may be all of them. I don't know. You'll have to give me the feedback down here in the comments below. But whichever states have already established these high-risk pools, they can't get funding from the Secretary of Health and Human Services to supplement that unless they make sure not to destroy what they already have. In other words, they've already put funding in there. They can't stop putting funding in their own pools while they're trying to establish a contract with the Secretary of Health and Human Services. That way, the Secretary doesn't have to pay you out more than what you'll actually need. Okay? Now, what is a qualified high-risk pool? It has to meet the following requirements. This pool of money will provide to all eligible individuals health insurance coverage that does not impose any pre-existing condition exclusion with respect to such coverage. In other words, when the individual who is sick applies for this high-risk pool, they can't say, oh, I'm sorry, you can't have this because you have a pre-existing condition. That doesn't exist anymore. You have to give them the coverage regardless of the pre-existing condition. Sorry. Alright? Now, this thing will provide health insurance coverage. This pool will provide health insurance coverage in which the issuer's share. Now, who is the issuer? This is either the state or the private not-for-profit health care insurance. That's the issuer. The issuer is either the state or the private non-for-profit health insurance company, in which the issuer's share of the total allowed costs of benefits provided under such coverage is not less than 65% of such costs. Alright. So, we're talking about covered costs here. If you go to get a medical procedure and that procedure is covered by this high-risk insurance, the issuer has to cough up 65% of that at the very least. Okay, and they may provide more, but they have to cough up at least 65% of all those covered costs. End of story. They have no choice. Okay? And it has an out-of-pocket limit no greater than what is stated in Section 223C2 of the Internal Revenue Code of 1986. Well, I looked up Section 223, Section C, Part 2 of the Internal Revenue Code of 1986. This deals with eligible individuals, okay, who are eligible for this. And these individuals, while covered under a high deductible health plan, okay, if these individuals are covered under a high deductible health plan, okay, they can't be covered under any other plan. They can be covered. They are covered under this high deductible health plan, but they cannot be covered under any other plan which is not a high deductible health plan or which provides coverage for any benefit which is covered under the high deductible plan. And that is a lot of words and a lot of stuff to cover, and I want you to think about it. Give me your responses down in the comments below. Tell me what you think. There's a lot more to this, and I will cover this in a future video. So I want you to stay tuned.